smoke, will you?
You want to kill me? You're crazy. I just want to talk to you.
Even if you've never smoked a joint in your life, you have sort of internal cannabis in your body. You have an endocannabinoid system, endo meaning inside. You've got cannabinoid receptors in your brain and in your liver and your spleen and your bladder and your immune system cells. You've got receptors all over your body for this plant. And so when you smoke, you're sort of stimulating and working within the endocannabinoid system, and you're stimulating your cannabinoid receptors. That helps to regulate your immune system, your energy, your metabolism, your blood sugar. It sort of tamps down inflammation. Your endocannabinoid system does a lot to maintain homeostasis in your body. By far, the most important thing I learned was that THC and CBD can kill cancer cells, that they can kill cancer cells while leaving healthy cells intact. They trigger a programmed cell death, which is called apoptosis. And not only do they trigger apoptosis, but they prevent the cancer cells from being invasive, from metastasizing. They prevent a growing tumor from signaling that it needs more blood supply, which is called angiogenesis. So cannabinoids, not just as a treatment for nausea and decreased appetite that happens because of chemotherapy, but cannabinoids actually being chemotherapy, actually treating cancer. That's really exciting to me.
So basically, at the Cannabinoid Medical Clinic, we assess patients for their suitability for what we call cannabinoid therapy. Cannabinoid therapy is not just medical marijuana. It's actually a whole class of therapy that is based on modulating the endocannabinoid system. For one of these therapies, a physician will write a prescription. If it's for Nabilone or Sativex, then we send them off. They pick up their medication at the pharmacy. If they do qualify for herbal cannabis, then we write a prescription for herbal cannabis, but they actually don't call it a prescription. They call it a medical document. And we actually help our patients figure out which company they should access their medical cannabis from.
As a sociologist, I don't have the abilities to study clinically the use of cannabis, but I do have people's own perceptions and their explanation of its benefits for them. It makes people feel better. You know, people who are using it on one hand for helping them alleviate depression, another might be using it for anxiety or as a sleep aid. Some people even using it as a stimulant to help them get out of bed in the morning or as a way to improve appetite. So what's fascinating about it is the wide variety of types of symptoms for which people find it useful on how it helps them. So that's been my experience, and I think it's valuable getting that perspective firsthand from the patients themselves.
Because it is only through knowledge that we can safely protect them. Failing this, the next tragedy may be that of your daughter, or your son, or yours, or yours, or yours.